Thank you for stopping by to learn about the work that we did. Our work is actually very timely with the recent death of the young actor, the 43-year-old actor Chadwick Boseman, who died of colorectal cancer earlier this month. So in the United States, colorectal cancer is the third most common cancer among adults and the third leading cause of cancer-related deaths. And there has been an increase in incidence of this malignancy in patients under the age of 50. For this exact reason, the American Cancer Society now recommends the colorectal cancer screening start at the age of 45 for adults with an average risk. However, this is a qualified recommendation, meaning that there is evidence of benefit, but there's less certainty about the benefit to harm ratio. In contrast, the recommendation for regular screening starting at age 50 is a strong recommendation, meaning that there is consensus of the benefits to risk ratio. And while some practitioners have started screening younger patients, this is still not common practice in the United States. And this might be because the United States Preventive Service Task has not yet changed their guidelines, their recommendation guidelines. And this is because this might be due to the fact that the differences in biology and presentation of colorectal cancer in younger population is still not fully understood. So in order to contribute to the ongoing efforts of having a better understanding of factors associated with premalignant polyps and colorectal cancer in this younger population, we conducted a retrospective chart review at Ascension Providence. So for our materials and methods, we conducted a retrospective chart review study. We collected data from patients between ages 18 and 85 who had undergone a colorectal resection due to either colorectal cancer or an advanced polyp in either the Providence hospitals in Southfield or Novi. And we got data from the last 10 years, so ranging from July 2009 to July of 2019, the end of July. We excluded any patients who had hereditary colorectal cancer, and also any patient who had the diagnosis of inflammatory bowel disease. Some of the factors we were looking at were gender, ethnicity, body mass index, comorbidities such as hypertension and diabetes, nicotine use, tumor location, and tumor stage at presentation. So we looked at all this data and then we compared these factors between the two age groups. So we separated patients by either younger than 50 or 50 and above. We used Excel to collect the data and to analyze the data, and we analyzed with chi-square analysis, comparing the proportion of patients in each group for each category. So some of the results that we got, our population had a total of 933 patients. You can see here the demographics table. 51% of all the tumors in both populations were in the ascending column, but we did see a trend where the younger population had 24.5% of the younger population had tumors in the sigmoid colon and 17.5% had in the rectum, and this was higher than for the older population. So there was more of a left-sided trend for the younger population. 78% of the patients were non-smokers, so a majority of our population. 83.4% of the patients had one or less comorbidities, and 72.5% were overweight or obese. And we saw something very interesting. It wasn't statistically significant, but we saw a trend where a higher proportion of the younger population was obese. So you can see here the orange bars represents the older population, and the blue bars represent the younger population. And you can see that here for the obese category, you see a reverse of the incidence. So it wasn't statistically significant, but this does agree with a lot of the research that has been coming out recently, linking obesity with chronic inflammation and tumor developments. So it's something that we definitely think that should be explored further. The one trend that we did see that was statistically significant was that a significantly higher proportion of the younger population had more advanced disease, had stage 3 and 4. So not only we are seeing an increased incidence of this malignancy in young people, but it seems like the tumor is more aggressive in this population. So we definitely think that further studies or possible revision of current literature that there's a significant number should be conducted to hopefully encourage some change in the screening guideline recommendations for this particular malignancy, so we can help better protect and care this vulnerable population who is increasingly suffering from this devastating disease. So thank you very much for stopping by to listen to our presentation and to the work that we did. And I hope you learned something. I hope you enjoyed. Thank you for your time.